and anybody in this room can disagree with me, and if they do, I'm sure they will come up to the mic and let me know. So, I compare this healthcare reform bill to education reform in the 70s, 80s, and 90s. If you recall, we took education from the state level, took it from the states and sent it to Washington, D.C., and we built the Department of Education. So we literally took billions and billions of dollars and sent it to Washington, D.C. So what we did is we took the decision away from parents, we took the decision away from teachers, and we took the decision away from principals. And we sent it all to Washington, D.C. so that someone sitting in D.C. will now decide what the curriculum will be in your local elementary schools, in your middle schools, and your high schools. And we are doing the same thing now with healthcare. We want to take the decision away from the doctors, we want to take the decisions away from the patients, and give it to some bureaucrat in Washington, D.C. to decide what kind of healthcare treatment that you will get or that you deserve. So, having said that, sitting on Ways and Means, and I've only been sitting on this committee for 8 months, which I think is very good for Northern Nevada. I don't think anybody sitting in this seat has sat on Ways and Means, but we get to hear healthcare. So one of the few committees that actually gets a hearing, and we only got one. One hearing on healthcare, and it lasted 16 hours. Started about 9 o'clock in the morning, went all the way around till about 1 or 2 o'clock in the morning the next day, straight. And because we were able to and allowed to provide some amendments to this proposal that was in front of us. Keep in mind, we had not a chance to read it at that point. It was the first time we'd actually had the legislation in front of us. Before I get too far, I want to go back just one step and say the biggest debate right now in Washington, D.C., or at least it was a couple weeks ago, when we broke for the recess and district work period, was whether or not we should actually read the legislation before we vote on it. And I'm not kidding you. I'm not kidding you. That was and is a discussion in Washington, D.C. Now, if I went to any elementary school and talked to a 5th grader or a 6th grader, or went to a middle school and talked to a 7th and an 8th grader and asked them, do you think your member of Congress should actually read the legislation before he votes on it? I think you and I both know what that answer would be. And yet we are debating that today in Washington, D.C. And as you know, it's not unheard of. We had a massive, massive energy bill that passed just 3 or 4 months ago. And that cap and trade bill came to Washington, and it was on my desk, and it was over 1,000 pages, and there was a 300-page amendment attached to it 3 hours before we were to vote on it. 3 hours. Why couldn't they have taken 24 hours? Why couldn't they have taken 72 hours? They have done nothing with it on the Senate side yet, and yet we're expected to vote on it. And my biggest fear on this piece of legislation, what we're seeing in front of us, is that they're going to come up with some 300 to 500-page amendment 2 hours before we're supposed to cast a vote and expect us to vote yes or no. Now, of course, I will vote no if that's the conclusion of the majority on the other side. But even on this energy bill, we had enough analysis of it to know that if I voted for that bill, 5,000 people in my congressional district would lose their jobs. Now, why would I vote for a bill that I know that through analysis that 5,000 people in my district would lose their jobs in these economic times? And so I'm very fearful we're going to do the same thing with health care. So this bill comes to Ways and Means. There's two reasons why you should not trust this piece of legislation. The first reason is, if it's not good enough for your congressional member, Congress chooses to exempt themselves, which they do in this legislation. If it's not good enough for Congress, it's not good enough for millions of Americans. As most of you know, that was my amendment in Ways and Means on this particular piece of legislation. The feedback was interesting. It didn't go down party line. There were some Democrats that did agree with me. Now, we'll give credit where credit is due. Shelley Berkeley from Southern Nevada did support that particular amendment, which I'm appreciative that she had. It came very close to passing, and I assure you haven't heard the end of it. Second reason why I don't trust this piece of legislation is because as long as they're not talking about tort reform, if there was if tort reform is not a discussion in healthcare reform, which analysis say will save probably somewhere between 20 to 25% in the cost of healthcare. 20 to 25% by having reasonable tort reform in this piece of legislation. Not one line, not one section is devoted at all to tort reform. So if there's no tort reform, I wouldn't trust it. If it's not good enough for your member of Congress, then it's not good enough for the American people. Having said that, and as a member of Ways and Means, I probably spent more time attempting to amend this bill than any other member. And some of them, perhaps a little bit more political, just to see where this piece of legislation was coming. Some of it more practical, trying to make sure that everybody had access to a good health care bill. Let me share with you something that I thought was good for my district, and that was debt forgiveness. You get a young man or woman out of just getting out of school, medical school, they probably have a debt somewhere between $200,000 and $250,000. Very, very difficult. Why don't we put them in underserved areas? If you serve in underserved areas in America, and that's usually rural America or rural Nevada, or even urban areas, very urban areas that are underserved, then a portion of your debt will be forgiven. Yeah. So if you serve for 3 years, in an underserved area, whether it's an urban area, or whether it's a rural area like Whitlock or Elko or Tonopah, or some of these areas that need more doctors, then a portion up to $100 would be forgiven, $100,000 would be forgiven, and that you have to serve in that area for another 5 years after that. What I think very reasonable legislation and very reasonable cost involved in that. Also, we all know how expensive it is for someone without insurance to go to your emergency room. It costs 5 times more for someone to walk into an emergency room than it does cost them to walk into a doctor's office. So let's tell all doctors that if you will see indigent patients, we will allow you to write off the cost of doing that, so that we can save the kind of money that you would save if it costs 5 times more to go to an emergency room. Let's send them to a doctor's office, let them get their care there, let them write that off, and unfortunately, on party line, that particular piece of legislation failed. And which is very unfortunate. I think it's very American. Actually, let me go back a minute. That didn't fail just on party line. There were Republicans that didn't support that particular amendment, and the reason that they didn't support it was because they figured, well, pro bono work from the lawyers and would have to be written up. I said, we don't have a pro bono problem in America. We have a healthcare problem, but let's solve that problem. A couple of other things that I want to share with you real quick, and then I'll take questions. Illegal immigrants. Should illegal immigrants get health care through this health care program that we're discussing? And my particular position was they'd have to prove that they are citizens. To get free health care, you'd have to prove that you're a citizen. Now, the argument was that legislation, that language is already in the legislation. And sure enough, there was something in there that said if you're an illegal immigrant, you do not get this health care. And that's fine as long as they enforced it. So what my legislation would have done is actually enforce it. The way it's written down in the legislation, you just have to say you're legal and you get health care. With my legislation, you have to prove you're a citizen, and then you get health care. And finally, and this was probably more political than it was practical, but I want to know what the tendency and what the direction of this particular legislation was. And specifically, I raised this question. Okay, we're going to have a public portion in this government portion of our health care. is the purpose of this government healthcare portion of this plan specific for the 50 million they claim are uninsured. If that's the case, then let's just cap it at 50 million. If that's the goal of this legislation, is to make sure that all Americans have health care, and we've determined, and frankly I said let the next census determine how many are uninsured out there, but whatever number is determined by the next census, which will happen in 2011, that will be the cap for the amount of people that go into the government option.